sick or healthy, young or old. 1% of the global population have been pushed out of a place they call home in search of a safe haven. About 80 million people in the world today have sought refuge or have been internally displaced, according to the United Nations. And this flow of refugees isn't slowing down. 10 million of them found themselves in this predicament in the last year alone.
We pledge to do everything in our power to end the conflict and persecution that drive these appalling numbers.
Millions have a second layer of vulnerability added this year due to a global pandemic that spreads quickly among people who live in close proximity to one another.
And many of them live in very crowded settlements, either in formal refugee camps or informal settlements, where there is very limited access to water, for one, but all of the kinds of precautions that we're reading about as best practice in terms of avoiding contamination, self-isolation, frequent hand washing, these are not necessarily always available.
The outbreak is also preventing humanitarian workers from reaching vulnerable populations. Borders are closed and international travel has slowed to nearly a standstill.
We really are hamstrung ourselves. We're stuck at home, we're stuck in airports, we have our things that we're intending to deliver, and this can be soap, food, blankets, the sort of infrastructure associated with getting more water into facilities, pipes and pumps and all these sorts of things.
In West Africa, 50 million people are threatened by hunger due to conflict, climate change, and rising food prices. The humanitarian group Care West Africa says the coronavirus outbreak is exacerbating this dire situation and making it hard for aid workers to reach the most vulnerable people.
So these people, they live on humanitarian assistance or support from their host communities. Currently, with restrictions, humanitarian actors have limited access to this population. So there is a challenge for them to ensure their daily needs. So if nothing is done for such population, in the coming months, we will have, I said, more than 50 million of them in food insecurity and food crisis.
And even when aid workers do have access to the population, many are forbidden from congregating to receive aid.
And when we talk about humanitarian assistance, it implies many times gathering people for either food distribution or for sexual and reproductive health support, etc. So these activities cannot be undertaken as initially planned. It delays or it takes longer.
As countries restrict travel and close borders, those who work closest with refugees ask leaders to be compassionate and remember that not all people cross borders because they want to. For some, they have no other choice.
We always feel that people should have the right to seek a safer life, and there are justifiable reasons why people are crossing borders. But against that, there is also the reality that the movement of people in itself is a risk. Linked to how the virus spreads. The challenge is about ensuring that when responses are put in place by governments, many of these responses are completely understandable, but that they take into consideration the reasons why people are fleeing, and they consider and they continue to be imposed with sort of humanitarian principles in mind.
Even if refugees take much needed precautions against the coronavirus, they still remain vulnerable due to circumstances they can't control. Salem Solomon, VOA News, Washington.